medical book. I spent about £35,000 in Birmingham just to get my hair back, but I couldn't do it. This was the last resort. I said, I'll spend so much money just do another again, but
what's the time after the first surgery, next surgery?
The minimum time difference is 6 months. 6 months means after 6 months, roughly, number one, your mobility becomes back to normal. So I can take a strip. Number two, your hair would grow as long as yours, or maybe a little longer, something like this thing. So I would know where the gaps are, so I can fill in the gaps. So that is why we need at least of about 6 months. I've done it for at 5 months. Most of my patients who are from abroad, they get it done once a year. You know, this summer they would come, next summer they would. It depends on when you can get holidays. How much time you need? All you need is, technically you need is 48 hours to 72 hours. You fly in, let's say you fly from here, if you fly in, you will reach there early morning Saturday. You get your surgery, you fly here on Friday night, you reach there on Saturday morning, you get your surgery done on Saturday morning, you stay a night in the hotel. On Sunday morning you can take the flight back to Birmingham. So all you need is a weekend over there.
How long scar should be disappeared after
the scar, you know, the scar would not be visible the next day if you have got hair about 1 inch long hair. If you have got that much hair, it will not be visible. But if you try to see it, it will be visible for at least 5 to 6 months, because it is the pinkishness which you would see, right? And that once it goes down, it takes about a year or 6 months to a year when that redness disappear, and that is most of the time when you would not be able to see the scar. There's some of my patients, I mean, who have gone to, I mean, their hairstylist have said that you are lying to me, you have done something else, I can't see your scar. Now, most of my scars are good, like him. If you see, and the ones which I've shown, but there are some people whose scars are not so good, right? But if I'm saying that 10% would have excellent scars, 10% would have bad scars. We are talking about 80% of the general population. This is called a bell graph of statistics. 10% on each sides are exceptions. So we don't talk about exceptions, we talk about the general population. 80% of my scars are like him. He is just an, I mean, most of his friends are happy like him. If they've had 2 surgeries done, they are happy like him. That is my average looking hair transplant.
so far I think it's about 500 people done it through me.
I've seen a couple of guys done the job by you, and I see their scar is absolutely good. Because I've seen it done by myself, by someone else, then compared to your patient.
He has seen that. I've told you my scars are not 100% good, but most of my scars can be compared. If you go on to the search, Dr. William Parsley is one of the pioneers of hair transplant in the world. When I was giving a lecture on hair transplant, on the scar, donor area scar, he came to me. It was this April in Orlando. There's a live surgery workshops, and I'm a faculty member, so I was teaching that. And he came to me and said, Humayun, we do trichophatic, we do this thing, we do that thing, we do that thing, and you do the same thing. So what are we missing that you are doing and getting this result, and we are not getting even half of that result? I said, look, everything boils down to the basics. When you are, as a plastic surgeon, I know the mobility. This is how much it should be. That will give me the strength, because if it is under tension, it will stretch. So I would rather do a smaller. I don't say, oh, I'm going to give you 4,000 grafts. No. There are clinics, we are just across the gallery, across those things, very close. They will tell you that, oh, we'll do one surgery, one stop. I said, no. If you want one step, go to them. I will give you this thing, but when I do it, you will get the best possible results.
I mean, fair enough, we have your customer credibility, and
so on your reputation. What about aftercare and complications?
Right, okay.
Especially in taking in mind that once you're 8,000 miles away.
Right, okay. Number one, he has had 2 surgeries done. He has had a surgery done. I've had 3 surgeries done. 98% chances that the complications are really not there. Small little pimples. But yes, some people would have problems. Infection, some bigger pimples, some complications. 2 of my patients, they had problem. I gave them the ticket to fly back to Pakistan. I sorted it out over here. Most of these things, if you need any help, over the internet, most of that thing can be solved. I tell you, I guide you. You go to your GP, you get your medicine. If there is any problem, if you're facing any problem, I am there. My main strength is, one of his friends had a complication, right? But most of these complications are only temporary. Most of these complications are only temporary. They go away, right? But if there is some important complications, then I'm always there. I'm not here to earn money out of you. I'm here to give you the services, and my name should be at a certain level, right? If I'm, last year alone I did 800 surgeries. I typed it down on an internet and the person said, well, you meant 80? I said, no, I meant 800. Right? If I'm not going to make money out of you and I lose money on you, no problem. There are 799 others who will give me profit. But my main aim is that I'll always be there. Even if I have to fly in over here, I'll do that. Or I'll ask you to come over and I'll reimburse the ticket of that thing for you. No problem. That is how I work. I don't know about other people. Right. Number 2, I don't give the guarantee that my hair transplant would come back, right? But I give you the guarantee you will not lose your money. There is a factor which is called X factor. That X factor is beyond the surgeon's control, and that could be anything when the hair does not grow. So what I do is that I give you complimentary surgery. In other words, with me, there is a consumer protection which is done by me. Nobody forces me to do that. In Pakistan, there is no law or nothing. I do it because I am a patient myself. And at the end of the day, I work for my reputation. I don't work for money. Money follows me. I don't want to run after money. I want to run after service. I want to be so that he or himself, I never met him before. All my patients are happy with me. If they are not even happy with the results, they are happy with me. That is what I want. That's it. And yes, sometimes it is difficult, but this is just like going to a dentist. Even lesser than that. So out of 100 patients, one might have a problem, but that problem usually gets resolved without any major sort of things. Just over the internet, I say, go and over the internet buy this medicine and you use it, or I shipped it to you through a friend of mine who is coming. I said, look, take this medicine. When you are in UK, post it to that gentleman. Worst come to worst, one patient was not really happy with his GP.